So I'm old enough that at age 61 that I didn't decide to go into HIV research. HIV came to me. So I began taking care of HIV patients in New York City in the early 1980s, long before we knew there was this virus or had a test, an antibody test to diagnose it, and long before the ACTG was created in 1986. So what I did is HIV came to me and I didn't run away from it. The good thing about medicine is that we never sit on our rear ends accepting what's going on. We always want to find new answers, new treatments, new ways to prevent diseases of any type. And the ACTG was one of the first large government-funded, as opposed to beholden to the pharmaceutical industry, one of the first large groups to really put a scientific structure on research. The most profound breakthrough in HIV research is without a doubt the realization that if you gave 3 or more antiretroviral drugs simultaneously, you could completely suppress the virus and allow for the immune system to recover, the CD4 counts to rise to normal or near normal, and theoretically allow patients with HIV to live a normal lifespan. That's clearly the biggest thing we learned, and the ACTG was instrumental in realizing that. Since 2000, I've been working in Africa and at our sites in Malawi, Zambia, and South Africa. And so my interest is what are the best regimens to both treat HIV and treat the complications of HIV in terms of the opportunistic infections and the AIDS-associated malignancies. What's the best way to diagnose them, to treat them, that's cheaper to do than we do in the United States, that's less toxic, and what's also, which is many might not see as a true goal of the ACTG, but I think is crucial, is that we know that at each step of the process of diagnosing and treating HIV or preventing mother-to-child transmission, whether in the United States or in Africa, each step there is dropout. Unless we make it so that there's no loss to follow-up, that if you start out with 100 HIV-infected patients, you end up with 100 HIV patients on treatment and suppressed, we're not going to make any really concrete advances in stopping this epidemic. Well, for fun, I am a competitive athlete, and I've done a half-iron triathlon this year. I run the New York Marathon. I've run it several times. I do open water swims. I do all that. I have a wonderful family, a wife and 2 grown daughters, and I'm a political activist. So I was arrested May 6th in the North Carolina legislature protesting the bad laws that our current legislature is doing.